All right, I wanted to discuss something today and wanted to hear your thoughts on this. I had a encounter with a gym member who has had knee pain for the past 6 months. Um, she told me that the knee pain started after a lot of pistols and front squats. So there wasn't any trauma or anything that occurred that um, was specific to her pain. However, in the days after this event or this workout, she noticed swelling and increased pain to the point that she stopped um, doing exercise and decided to go get x-rays and found nothing. And then she also went and got an MRI. This MRI showed nothing because I thought it was a meniscus. So it didn't show nothing, but it didn't show what they thought, which was they thought that she had tore her meniscus, which is the cartilage cushioning between your big femur bone and your tibia bone, which creates the knee. What they did find is a grade 1 MCL tear or sprain, excuse me. And so the MCL is your medial collateral ligament on the inside of your knee. And she got a steroid injection and then began physical therapy treatment at a clinic who started treating her, and fortunately, fast forward 6 months later, and she still has probably 20 degrees of range of motion loss, and she is not comfortable in her squat, although her squat does look full. And I was able to discuss with her kind of what the PTs were treating her for, and she told me that she was receiving treatment for her ankle. I quickly screened her ankle, and it was certainly not her ankle that was causing her knee pain. She said that she was getting treatment for her hips, and I quickly screened that, and also just knowing her exercise history, I knew that it was not her hips that were problematic in her knee. It was, in fact, the fact that she had decreased range of motion and some swelling in her knee that hasn't gone away. And so the simple fix here, unfortunately, is what is the person coming in for? And that was knee pain. And they were not treating the knee, they were treating other places. So simply put, we need to decrease the swelling. And sometimes that means activity modification. So things that increase the swelling would likely be fold up squats, loaded squats, running and jumping activities. Those would be likely contributing to her swelling. And we want to return to full range of motion so that when we do squat, there's a pain-free full range of motion squat, body squat first, and then gradually load the body weight with weight over time, and then returning to CrossFit related activities. She is unfortunately not getting this care from the PT that she's been seeing, and it's likely because this PT is being shared with multiple patients. In other words, this PT is seeing not just this patient, but multiple patients, which is why I left the outpatient realm and decided I needed to do my own physical therapy business, because a grade 1 MCL sprain should have been done 3-4 months months ago. And it's unfortunate that she's still living with us now. So a little bit of thought, food for thought. This is why I want to help people stay in the gym, make good decisions, and be resilient, because our healthcare system isn't helping.